What if I told you that one of the most powerful brain protecting substances on this planet has been sitting in your kitchen spice cabinet, possibly for years, and you never knew what it could do for your mind? Here's what makes this even more remarkable. You only need 1/8 of a teaspoon every single day. That's less than a pinch. That's nothing. And yet, science behind what this tiny amount can do to protect your aging brain is absolutely extraordinary. I've been practicing medicine for over 4 decades. Supplement. I have sat across from thousands of patients, brilliant people, sharp people, people who were sharp, and watched cognitive decline steal them piece by piece. And many of those cases, many of them could have been different. If only they had known sooner. Today, I'm going to change that for you. Stay with me all the way through this video, because what I am about to share could genuinely be one of the most important things you will ever hear for the long-term health of your brain. Introduction. What you're looking at is saffron. No, real saffron. And before you think, oh, that's just a cooking spice, I need you to stop right there, because that thought could cost you years of your mental clarity, your memory, and your independence. Saffron has been used in traditional medicine for over 3,000 years. Ancient Persian physicians, Greek healers, Ayurvedic doctors, they all knew something. Just didn't have the technology to explain why it worked. We do now. And the research, the peer-reviewed, published clinical research, is nothing short of remarkable. Here's the tragedy I see in my practice every single day. People are spending hundreds of dollars on fancy brain supplements, expensive memory pills with long scientific names on the label and very little science behind them, while one of the most studied, most powerful neuroprotective compounds on earth costs almost nothing and can be measured in a fraction of a teaspoon. So today, I'm going to walk you through exactly what saffron does to your brain, why it matters as you age, what the research actually says, what mistakes people make, and most importantly, what you should do starting today. Let's get into it. Potuine tea, 1 saffron, and the silent epidemic destroying brains worldwide. Before I tell you what saffron does, I need you to understand what we are fighting against, because most people don't realize this until it's too late. Right now, over 55 million people worldwide are living with dementia. That number is expected to nearly triple by 2050. Alzheimer's disease alone kills more people every year than breast cancer and prostate cancer combined. See, and here is what keeps me up at night as a physician. By the time someone is diagnosed with cognitive decline, the damage in the brain has often been building quietly for 10 to 20 years. You understand what that means? The brain changes that lead to Alzheimer's and dementia, the plaques, the tangles, the inflammation, the oxidative stress, those processes begin decades before any symptom appears. You forget where you put your keys and you laugh it off. You walk into a room and forget why. You struggle to find the right word mid-sentence and you chalk it up to a long day. But your brain has been trying to warn you. I had a patient, a retired school teacher, 68 years old, brilliant woman, sharp as a tack her whole life. She came to me when she started having senior moments, as she called them. By the time we evaluated her properly, the early markers of neurodegeneration were already present. She told me, "Doctor, if only I had known 5 years ago." That sentence haunts me. It drives everything I share on this channel. The point is this: protecting your brain is not something you do after the symptoms appear. It is something you do now. It is something you do every single day. And saffron, this humble little spice, has some of the most compelling evidence behind it for doing exactly that. Point two, what saffron actually does inside your brain. The science without the confusion. Let me break this down in plain English, because you deserve to understand your own body. Your brain is made up of billions of neurons, nerve cells, that communicate with each other through chemical signals. As we age, several damaging processes accelerate inside the brain. Number one is oxidative stress, essentially your brain cells being rusted from the inside by harmful molecules called free radicals. Number two is neuroinflammation, chronic, low-grade inflammation that slowly damages and destroys brain tissue. Number three is the accumulation of beta amyloid plaques, the sticky protein deposits that are the hallmark of Alzheimer's disease. Okay, number four is the breakdown of key neurotransmitters like acetylcholine, which is absolutely critical for memory and learning. Now, here is where saffron becomes extraordinary. Saffron contains two primary active compounds, crocin and crostine. These are the pigments that give saffron its brilliant golden red color. Supplement, and these compounds have been shown in multiple studies, human clinical trials, not just lab studies, to cross something called the blood-brain barrier. That is critically important. Supplement, many substances you put in your body cannot enter the brain directly. They get filtered out. Crocin and crostine can get in, and once they're inside the brain, here is what they do. They act as powerful antioxidants. They fight that oxidative rusting I mentioned. They reduce neuroinflammation. They have been shown to inhibit the clumping of those dangerous beta amyloid proteins. And perhaps most impressively, studies suggest they support the activity of acetylcholine, the very neurotransmitter that Alzheimer's medications are designed to protect. A landmark study published in the journal Psychopharmacology compared saffron directly to donepezil, that's one of the most commonly prescribed Alzheimer's medications in the world. The result? Saffron performed comparably in improving cognitive function in mild to moderate Alzheimer's patients. Let that sink in. A natural spice that you can buy at the grocery store, performing comparably to a pharmaceutical drug. Now, I want to be very clear. I am not telling you to throw away your medications. If you are under a doctor's care, follow your doctor's guidance. What I am telling you is that the evidence behind saffron for brain protection is real. It is published, and it deserves your serious attention. And the dose used in the majority of these studies, approximately 30 milligrams per day. That is right around 1/8 of a teaspoon of high-quality saffron. Point three, the memory and mood connection. What most doctors never tell you here is something I want every person over 60 watching this video to understand clearly. Your mood and your brain health are not separate issues. They are deeply, profoundly connected. And this is where saffron's benefits become even more remarkable. There is a compound in saffron called safranal. And safranal works on something called the serotonin system in the brain. Serotonin is your brain's feel-good chemical. It regulates mood, sleep, appetite, and emotional well-being. As we age, serotonin pathways can become less efficient. This is why depression is so common in older adults. And this matters for brain health because chronic depression and anxiety are themselves significant risk factors for cognitive decline. I've seen this connection destroy lives in the most heartbreaking way. A patient of mine, a retired engineer, 72 years old, came in complaining of memory issues. But when I spent real time with him, What I found was that underneath the memory complaints was severe untreated depression. He had lost his wife 2 years before. He was isolated. He wasn't sleeping well. He had lost his sense of purpose. His brain was drowning in stress hormones like cortisol. And high cortisol, sustained over time, literally shrinks the hippocampus. That is the part of the brain most critical for forming and storing memories. We addressed his depression. We got him engaged with life again. We looked carefully at his nutrition, and his cognitive function improved significantly within months. Not because we did something magical, because we treated the whole person. Saffron has been studied specifically for its antidepressant effects, and several clinical trials have found it comparable to standard antidepressant medications for mild to moderate depression, with far fewer side effects. The mechanism appears to be its action on serotonin reuptake, essentially the same pathway that prescription antidepressants target. What most people do wrong is that they treat their memory separately from their mood, their sleeps separately from their anxiety, their diet separately from their brain. The brain is not a compartment. Everything is connected. And saffron is one of the few natural substances that appears to address several of these pathways simultaneously. Now let me be very direct with you here. If you are experiencing significant depression or anxiety, please work with your physician. This is not a replacement for professional care. It is part of a comprehensive approach to brain health. The research on saffron is genuinely exciting. Point 4, the inflammation time bomb, and why saffron helps diffuse it. I want to talk about something that most people have heard of, but very few truly understand, and that is chronic inflammation. Because in 40 years of medicine, if there is one underlying mechanism I have watched quietly destroy more lives than almost anything else, it is this. Acute inflammation, the kind that happens when you cut your finger or sprain your ankle, is a good thing. It is your immune system doing its job. The problem is chronic, systemic, low-level inflammation, the kind you cannot feel, cannot see, and often cannot measure without specific blood tests. This is sometimes called inflammaging, the chronic inflammation that drives the aging process itself. Inflammaging is directly linked to Alzheimer's disease, Parkinson's disease, cardiovascular disease, type 2 diabetes, certain cancers, and accelerated cognitive decline. And here is what is especially alarming. Our modern lifestyle, processed foods, chronic stress, poor sleep, sedentary behavior, environmental toxins actively fuels this inflammatory fire inside our bodies every single day. Now your brain is particularly vulnerable. The brain has its own immune system, special cells called microglia. When the brain is healthy, microglia act as protectors, cleaning up debris and fighting threats. But when chronic inflammation is present, these microglia become overactivated. They start damaging healthy neurons instead of protecting them. Scientists now believe this microglial dysfunction is one of the central drivers of Alzheimer's disease. Here is where saffron steps in, specifically its crocin compound. Studies have shown that crocin has direct anti-inflammatory effects in brain tissue. It appears to calm overactivated microglia, reduce inflammatory signaling molecules called cytokines, protect neurons from inflammatory damage. One of my patients, a 65-year-old gentleman with a strong family history of Alzheimer's, came to me after watching a family member decline. He was scared. He wanted to do everything right. We worked together on a comprehensive protocol: diet, exercise, sleep, stress management, and saffron became part of his daily routine. 4 years later, his cognitive testing scores have remained strong. His inflammatory markers have improved. He is sharp, he is active, and most importantly, he is not afraid anymore. I am not claiming saffron cured or prevented anything for him. What I am saying is that every tool that helps fight chronic inflammation is a tool worth having. The evidence for saffron as an anti-inflammatory compound, particularly for the brain, is growing stronger with every passing year. Point 5. The vision, the sleep supplement, and the hidden bonuses most people miss. Here's something that surprises my patients almost every time I bring it up. The benefits of saffron for the aging body go well beyond just the brain. And these additional benefits are directly relevant to your quality of life as you get older. Let's talk about vision first. Age-related macular degeneration, AMD, is the leading cause of vision loss in people over 50 in the Western world. And once you start losing your central vision, tasks like reading, recognizing faces, and driving become increasingly difficult or impossible. Studies conducted in Australia and Italy have shown that saffron supplementation, again, supplement at approximately 20 to 30 milligrams daily, significantly improved visual function in patients with early AMD. Researchers believe the crocin in saffron protects the delicate photoreceptor cells in the retina from oxidative damage. Think about what that means for independence. For many older adults, losing their vision is the beginning of the end of their independence. Anything that supports eye health as we age is not a luxury. It is a lifeline. Now let's talk about sleep. Cannot overstate how critical sleep is for brain health. During deep sleep, the brain activates what scientists call the glymphatic system, essentially a built-in cleaning process that flushes out toxic proteins, including beta amyloid, from brain tissue. If your sleep is poor, this cleaning process is impaired. The toxic buildup accelerates. This is a direct pathway from poor sleep to increased dementia risk. Saffron has been studied for its effects on sleep quality, and the results are encouraging. Several clinical trials have found that saffron supplementation, again at small doses, improved sleep quality, reduced time to fall asleep, and decreased nighttime awakenings in both younger and older adults. The mechanism appears to involve saffron's action on GABA receptors, the brain's natural calming system. And here is the beautiful cascade effect I want you to appreciate. Better sleep means better glymphatic cleaning, which means less toxic protein buildup, which means lower dementia risk. Better sleep also means lower cortisol, which means less hippocampal shrinkage, which means better memory. Better sleep means improved mood, which means less depression-related cognitive risk. Everything connects. And saffron appears to touch multiple nodes in this interconnected system. Emotional connection, why? This matters beyond just you. I want to take a moment to step away from the science and speak to you directly, heart to heart. If you are over 60, sure, if you have a parent, a spouse, a sibling who is over 60, I need you to truly feel the weight of what we are talking about here. Because this is not just about remembering where you put your keys. This is about who you are. Your memories are your life story. They are the faces of your children when they were young. The day you got married, the smell of your mother's cooking, the pride you felt when you achieved something that mattered. Your ability to think clearly, to make decisions, to engage in conversation, to contribute to the people you love. That is your identity. That is your dignity. That is your independence. I have watched families shattered by dementia. I have seen spouses become full-time caregivers. Children make agonizing decisions about nursing homes, and patients look at their loved ones with no recognition in their eyes. There is nothing in medicine that is harder to witness, and there is no pharmaceutical that restores what has been lost once the damage reaches that stage. Here is what I also know with absolute certainty after 4 decades: prevention works. The choices you make today, the food you eat, the movement you pursue, the stress you manage, supplements you thoughtfully add, these choices echo forward in time. They shape the version of yourself you will be at 75, at 80, at 85. You deserve to grow old with your mind intact. Your family deserves to have you fully present. Supplement, and if something as simple and accessible as a tiny amount of saffron each day can be one meaningful piece of that protection, and the evidence suggests it can, then you owe it to yourself and to the people who love you to take that seriously. It's how to use saffron practical guidance. Do this right now. Let me give you the practical information you need, because knowing something without knowing how to use it does you no good at all. The dose used in the majority of clinical studies is between 20 and 30 milligrams of saffron per day. In practical kitchen terms, this is approximately 1/8 of a teaspoon of ground saffron threads or high-quality powdered saffron. If you are using whole threads, which is the purest form, you can steep a small pinch in warm water for 10 to 15 minutes and drink it as a tea. Or you can add it to warm milk, broth, soups, rice dishes, or smoothies. The mild, slightly floral, earthy flavor blends beautifully with many foods. Now here is where people make costly mistakes. Not all saffron is created equal. Because saffron is the most expensive spice in the world by weight, it takes tens of thousands of hand-picked crocus flowers to produce a single pound. The market is unfortunately filled with adulterated products. Fake saffron, dyed saffron, saffron mixed with other plant material, or so-called saffron that contains almost no active compounds at all. What you want to look for: deep red threads with slightly orange-yellow tips. Real saffron should release a golden yellow color when steeped in warm water, not an immediate bright red. Its flavor should be slightly bitter and floral, not musty or tasteless. Look for saffron from reputable sources. Spanish, Iranian, or Kashmiri saffron are among the most highly regarded. And if you are buying a supplement form, look for a standardized extract with verified crocin content from a reputable brand with third-party testing. Supplement. One more thing: saffron is generally considered very safe at these small doses for most people. However, if you are pregnant, on blood-thinning medication, or managing any serious medical condition, please consult your doctor before adding anything new to your routine. Supplement. At very high doses, far beyond what we are discussing, saffron can be problematic. At 1/8 of a teaspoon daily, the safety profile across research studies has been excellent. The bigger picture's saffron is powerful, but it's not alone. I want to be completely honest with you, as I always am, because you deserve a physician who respects your intelligence. Saffron is not a magic bullet. No single food, no single supplement, no single anything is. The human body and the human brain is magnificently complex. What protects it is the sum of many good choices made consistently over time. Saffron works best as part of what I call the longevity framework, and that means regular physical movement, because exercise increases brain-derived neurotrophic factor, which is essentially fertilizer for your brain cells. It means a diet rich in colorful vegetables, healthy fats, and clean protein, and low in processed foods and refined sugars. It means quality sleep, 7 to 8 hours for most adults, which is when your brain does its most critical repair work. It means managing chronic stress, which is one of the most underestimated threats to the aging brain. It means staying socially and mentally engaged, because a stimulated brain is a resilient brain. But within that framework, saffron has earned its place. It is backed by real science. It is accessible. It is affordable. And at just 1/8 of a teaspoon a day, the investment is almost laughably small compared to what it may protect. Now listen, if this video gave you something valuable today, if it shifted your thinking even slightly about what you can do right now to protect your brain, then I need you to do something for me. Hit that like button right now, because it tells this platform that this information matters and it helps more people find it, people who may genuinely need it. Subscribe to Longevity Lane with Dr. Mandell if you haven't already. Every video I create here is built on one single mission: to get you the truth about your health before it's too late to act on it. Not the watered down version, not the version filtered through commercial interests. The real evidence-based truth from a physician who has spent 40 years watching what actually works. And leave me a comment below. Tell me, have you ever used saffron? Have you noticed anything? Are you going to try it after today? Your stories matter to me, and they help other viewers too. Share this video with someone you love who is over 60. Send it to your parents. Send it to a friend who has been worried about their memory. Your health depends on this information, and so does theirs. Don't keep it to yourself. So let me leave you with this thought. In medicine, we talk a great deal about treatment. We spend billions of dollars and millions of hours treating disease after it has taken hold. But the most powerful medicine I have ever witnessed in 40 years of practice is not a drug, not a surgery, not a procedure. It is the daily decision made with intention and knowledge to take care of the body and the mind before the damage is done. You are watching this video today. That means something. That means you care. That means you are not waiting until a crisis forces your hand. That is the mindset of someone who will age with strength, with clarity, and with grace. It's 1/8 of a teaspoon every day, steeped in warm water, added to your morning meal, dissolved into your evening tea. Such a small thing. And yet, the brain you protect may remember every moment of the life you still have ahead of you. Take care of that brain. It is the seat of everything you are. I will see you in the next video. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, supplement, and healthier life, then subscribe to Longevity Lane with Dr. Mandell. Here, we reveal the health truths most people discover only when it's already too late.